10 minutes. That's what I'm asking from you today. Not an hour at the gym, not a new supplement, not a dietary overhaul. 10 minutes of one specific kind of movement done consistently every single day that the evidence says can reduce your risk of developing dementia by numbers that sound almost too good to be true. 76%. I'm going to say that again so it lands properly. 76% risk reduction. That number comes from a large-scale observational study. And I'll give you the full context of what it means because context is everything with statistics like that. But first, I want you to understand why the number is not as surprising as it sounds once you understand what's actually happening in the brain during this kind of movement. Because the mechanism is not vague, it's not exercise is good for you. It's a specific documented cascade of molecular events triggered by a specific type of physical activity that directly counteracts the biological processes underlying Alzheimer's disease and other forms of dementia. And once you understand the mechanism, 10 minutes a day feels not like a recommendation, but like an obvious biological necessity. Every minute of every day, your brain is doing something extraordinary. It's cleaning itself. There is a waste clearance system in the brain called the lymphatic system, discovered relatively recently with the landmark paper published in Science in 2012 by a team led by Dr. Mike Nettergaard at the University of Rochester. The lymphatic system uses cerebro's spinal fluid to flush metabolic waste products out of the brain parenchyma, including beta amyloid, the protein that aggregates into the plaques characteristic of Alzheimer's disease, and tau, the protein that forms neurofibrillary tangles. This system operates primarily during sleep, but it also responds to movement. Specifically, rhythmic oscillatory movement, the kind produced by walking, cycling, or other repetitive locomotive activity, drives a pulsatile flow of cerebral spinal fluid through the brain's interstitial spaces that enhances lymphatic clearance. What this means practically is that when you walk, you are not just conditioning your cardiovascular system. You are physically pumping waste out of your brain. The amyloid that would otherwise accumulate and trigger the inflammatory cascade that kills neurons is being cleared more efficiently. The tau that would otherwise misfold and propagate through neural networks is being removed. Movement is not metaphorically good for brain health. Movement is mechanistically essential for brain waste clearance. If this is your first time on this channel, I want to be upfront about what we do here. We translate the research, we don't oversell it, we don't oversimplify it, and we don't present emerging science as settled fact. What I just described about the lymphatic system is well established. Tier 1 mechanism replicated across multiple species and increasingly supported in human data. What I'm about to tell you about exercise and dementia risk sits in a more nuanced space. There is strong epidemiological evidence. There are compelling mechanistic explanations. And there is genuine scientific consensus that physical activity is one of the most powerful, modifiable risk factors for dementia. But I'll be precise about which claims are well established and which are emerging. That precision is what makes this channel worth your time. Subscribe if you want to stay in that conversation. We're close to 100,000 people building this community together. Let me tell you about a patient I'll call Eleanor. She was 73 when she came in, referred by her daughter who had noticed she was repeating herself in conversation and having difficulty finding words. Cognitive testing revealed performance consistent with mild cognitive impairment, a transitional state between normal aging and dementia that carries a significantly elevated risk of progression to Alzheimer's disease. Eleanor's previous workup had been limited. No one had systematically addressed her modifiable risk factors. Her physical activity level was essentially zero. She drove everywhere. She spent most of her day seated. Her sleep was fragmented. She was waking multiple times per night, which we later discovered was due to undiagnosed sleep apnea. Her blood pressure, while technically controlled on medication, showed significant morning variability that the clinic visits had never captured. And nobody had ever spoken to her seriously about exercise. Not about its specific documented mechanistic benefit for brain health, but about what happens at the cellular level in the brain when a 73-year-old woman walks briskly for 10 minutes a day. When we had that conversation and when Eleanor understood the mechanism, not just exercise is good for you, but specifically why walking clears amyloid, stimulates BDNF, improves cerebral blood flow, and promotes hippocampal neurogenesis. She made a different decision than she had ever made before, because she finally understood what she was doing and why it worked. 12 months later, her cognitive test scores had improved, not dramatically. We are not making claims of reversal here, but measurably and meaningfully. Here's the biological cascade that makes this work. And I want you to stay with me through this because every step matters. Think of the hippocampus, the seahorse-shaped structure deep in the temporal lobe that is your primary memory formation center, as a garden. A living, dynamic garden that can grow new neurons throughout your adult life. A process called adult hippocampal neurogenesis. This was once considered impossible in humans. It is now established biology, with research in Nature Medicine confirming active neurogenesis in the human hippocampus even into the 9th decade of life. The critical question is what makes the garden grow? What signals the hippocampus to produce new neurons, to form new synaptic connections, to maintain the cognitive reserve that buffers against dementia? The answer, supported by an overwhelming body of research, is a protein called BDNF brain, derived neurotrophic factor. BDNF is the brain's primary growth and survival signal for neurons. It promotes neuronal survival, stimulates the growth of new synapses, enhances long-term potentiation, the cellular basis of learning and memory, and directly stimulates hippocampal neurogenesis. And aerobic exercise is the single most potent non-pharmacological stimulus for BDNF production that we know of. A meta-analysis published in Neuroscience and Biobehavioral Reviews found that aerobic exercise consistently and significantly elevates circulating BDNF levels. A landmark randomized controlled trial by Kirk Erickson and colleagues published in the Proceedings of the National Academy of Sciences in 2011 found that adults over 60 who engaged in a walking program increased hippocampal volume by 2% over 1 year, reversing approximately 1 to 2 years of age-related hippocampal shrinkage. 2% in 1 year from walking the garden responds to the right conditions. Now let me address the 76% figure directly, because statistical literacy is part of what we do here. That number comes from a large prospective cohort study, the Hunt Fitness Study from Norway, which tracked over 30,000 adults over decades and examined the relationship between cardiorespiratory fitness and dementia risk. Participants with the highest levels of cardiorespiratory fitness showed a 76% lower rate of dementia compared to those with the lowest fitness levels. This is a powerful finding, but it's observational, meaning it cannot definitively prove that the exercise caused the dementia reduction rather than that healthier people happen to exercise more. The Bradford Hill criteria, the framework epidemiologists use to assess causality in observational data, are largely met here. The association is strong, it's consistent across multiple independent studies. There is a dose-response relationship, and the mechanistic explanation is biologically plausible and increasingly supported by direct experimental evidence in humans. The scientific consensus, as reflected in guidelines from the World Health Organization, the American Academy of Neurology, and Alzheimer's Research UK, is that physical activity is one of the most important modifiable risk factors for dementia. The 76% is the top end of what the data shows. A more conservative estimate, still remarkable, is 30 to 40% risk reduction from sustained aerobic exercise over a lifetime. At any end of that range, the intervention is extraordinary. Drop your age in the comments below. And here's specifically why it matters for this topic. The biology of exercise-induced brain protection works differently depending on where you are in the aging process. Under 55, the primary mechanism of benefit is building cognitive reserve, the neurological surplus measured in synaptic density and hippocampal volume that allows the brain to sustain Alzheimer's pathology for longer before symptoms emerge. Exercise in your 40s and early 50s is building that reserve. Between 55 and 70, the mechanisms shift somewhat. Neuroinflammation begins to accelerate in this window. Cerebral blood flow starts to decline. the clearance efficiency of the glymphatic system decreases. Exercise in this window is actively counteracting those processes in real time, reducing neuroinflammation through interleukin-6 and interleukin-10 signaling, maintaining cerebral autoregulation through cardiovascular fitness, and supporting glymph function through the pulsatile CSF flow that rhythmic movement produces. After 70, the evidence for neurogenesis continues to apply, but the appropriate exercise intensity needs to match what the cardiovascular and muscular skeletal system can tolerate. High-intensity exercise is not necessary for brain benefit. The threshold for significant BDNF elevation and glymphatic enhancement is moderate intensity, enough to elevate the heart rate to 60 to 75% of maximum, but not more. So, your age tells me what you're building and at what pace. Drop it below. Here is the one move daily practice, the specific 10-minute protocol that the evidence supports, explained precisely so you know how to do it and what you're actually achieving. The move is brisk walking, not a stroll, not a leisurely window shop. Brisk walking at a pace that elevates your heart rate to the point where you can still speak in sentences but would not comfortably sing. This is the moderate intensity threshold. The physiological target is approximately 60 to 75% of your maximum heart rate, which you can estimate by subtracting your age from 220. A 60-year-old has an estimated maximum heart rate of 160 beats per minute. 60 to 75% of that is 96 to 120 beats per minute. That's your target range for the brisk walk. Why is brisk walking specifically the intervention rather than strength training or yoga or Tai Chi? Because the evidence base for BDNF elevation, hippocampal volume preservation, and glymphatic clearance is most concentrated around sustained rhythmic, moderate intensity aerobic activity. Strength training has cognitive benefits. It reduces insulin resistance. It reduces inflammatory markers. And there is emerging evidence that it too elevates BDNF. Yoga and Tai Chi have documented benefits for balance, cortisol reduction, and mental health. But the specific cascade of events, the rhythmic oscillatory driving of cerebral spinal fluid, the sustained elevation of BDNF, the increase in cerebral blood volume is most robustly triggered by sustained rhythmic locomotion. Walking is the most accessible, the most studied, and the most consistently supported form of that locomotion across all age groups. 10 minutes of brisk walking every day is the floor. 30 minutes, 5 days a week is the standard associated with maximum cognitive benefit in the literature, consistent with American Heart Association recommendations. But 10 minutes daily done consistently beats 30 minutes done sporadically every second or third day. Consistency is the variable that matters most. The brain responds to sustained regular signals. A 10-minute walk every single day sends a more powerful and more consistent signal than a 45-minute walk twice a week. Here is how to make the 10 minutes work. Do it outdoors when possible. Sunlight exposure during the walk activates vitamin D synthesis in the skin, and vitamin D insufficiency is independently associated with accelerated cognitive decline, with research from the University of Exeter showing that severe vitamin D deficiency nearly doubles dementia risk. The outdoor environment also provides sensory enrichment, novel visual input, proprioceptive challenge from uneven terrain, and the attention restoration that natural environments provide, all of which add cognitive stimulation on top of the physical benefit. Choose a route with some variation. Hills are ideal if you can tolerate them. The cardiovascular demand is higher on an incline, which means greater BDNF elevation in shorter time. Walk without headphones at least some of the time. The sensory engagement of attending to the environment around you adds a layer of cognitive activation that passive listening to a podcast does not, and walk in the morning when possible. The glymphatic system's responsiveness to movement is highest in the first half of the day, when cerebral spinal fluid production is at its peak, and starting the day with a brisk walk sets the neurological tone. Reducing cortisol, improving insulin sensitivity, and establishing the cardiovascular activation that carries benefits throughout the day. 10 minutes brisk pace outdoors every morning. That is the protocol. It costs nothing. It requires nothing except a pair of shoes and the commitment to do it daily. The evidence on dementia prevention has never been clearer, and it has never been more actionable. We know what the brain needs. We know what drives neurogenesis. We know what clears amyloid. We know what sustains the hippocampus. And it is not a pill. It is not a supplement. It is movement. Specific, rhythmic, daily, moderate intensity movement. The pharmaceutical industry has spent billions on Alzheimer's drug development, and the clinical trial record is one of the worst in all of medicine. Failure after failure. Because intervening on a disease that has been accumulating for decades once symptoms appear is extraordinarily difficult. Prevention built into your daily life through something as simple and free as a 10-minute walk is where the evidence actually points. Your brain responds to what you actually do every morning, every day. Start tomorrow. Your health is your responsibility, not the pharmacy's. I'll see you in the next video. Let me go deeper into this cerebrovascular mechanism because it adds a dimension to the exercise dementia story that doesn't get enough attention. Dementia is not only a disease of protein aggregation, it is also substantially a disease of vascular failure. Vascular dementia caused by reduced blood flow to the brain from small vessel disease, atherosclerosis, or recurrent microinfarcts accounts for approximately 20 to 30% of all dementia cases. But beyond that, growing evidence suggests that vascular compromise is a co-actor even in Alzheimer's dementia. The cerebral small vessel disease that produces white matter hyperintensities on brain MRI, those bright spots on scans that radiologists often describe as age-related changes, is not benign. It reflects damage to the small arterioles and capillaries that supply the brain's deep white matter and subcortical structures. When these vessels are diseased, the neurovascular unit, the intimate partnership between neurons, astrocytes, parasites, and endothelial cells that regulates blood-brain barrier function and cerebral blood flow, begins to fail. Amyloid clearance depends on a functioning neurovascular unit. Synaptic function depends on tight blood-brain barrier integrity. When that unit degrades, the brain becomes vulnerable to both ischemic damage and amyloid accumulation simultaneously. Aerobic exercise directly protects the neurovascular unit. Research published in the Journal of Cerebral Blood Flow and Metabolism has shown that regular aerobic exercise reduces cerebral small vessel inflammation, improves endothelial nitric oxide production, which maintains vascular flexibility, and increases cerebral blood volume in regions particularly vulnerable to dementia pathology. This is not a peripheral benefit. This is the vascular architecture of your brain being actively maintained by the daily choice to move. I also want to address cognitive reserve more explicitly because it's a concept that changes how people think about prevention. Cognitive reserve is the brain's capacity to tolerate pathology before it produces symptoms. It's built over a lifetime through education, cognitive stimulation, social engagement, bilingualism, and physical activity. People with higher cognitive reserve can carry a significant amyloid burden measurable on PET scan without meeting diagnostic criteria for dementia, because their brains have developed redundant pathways, denser synaptic networks, and more efficient neural processing. Exercise contributes to cognitive reserve through multiple mechanisms. It increases hippocampal volume, it promotes synaptogenesis in the prefrontal cortex, and it reduces the rate at which age-related atrophy proceeds. A 50-year-old who walks briskly for 30 minutes most days is building a neurological buffer that may not become clinically relevant until their 80s, when instead of meeting dementia criteria, they are managing mild cognitive changes that do not substantially impair their independence or quality of life. That buffer cannot be purchased. It cannot be pharmaceutically induced. It is built cell by cell and synapse by synapse through the cumulative effect of daily physical activity over decades. Starting at 50 is good. Starting at 60 is still meaningful. Starting at 70 still produces measurable hippocampal volume preservation in randomized trials. The biology responds at every age. But the earlier the investment begins, the larger the reserve that accumulates. One final mechanism that deserves direct attention is the relationship between exercise, insulin resistance, and Alzheimer's disease. There is a body of research, still somewhat controversial, but gaining traction that has led some researchers to describe Alzheimer's disease as type 3 diabetes. The core observation is this: the insulin signaling pathway is essential for neuronal survival and synaptic function in the brain. Neurons have insulin receptors. They respond to insulin. They require insulin signaling to maintain their energy metabolism and to prevent apoptosis, programmed cell death. In individuals with insulin resistance, the brain's insulin signaling becomes impaired. Neurons become metabolically stressed, and the toxic effects of amyloid and tau are amplified. Aerobic exercise is the single most powerful non-pharmacological intervention for improving insulin sensitivity. It increases GLUT4 transporter expression in skeletal muscle, improves hepatic insulin sensitivity, reduces visceral adiposity, and reduces the circulating inflammatory cytokines that drive peripheral and central insulin resistance. This means that every time you take that 10-minute brisk walk, you are improving the insulin signaling environment in your brain, making your neurons more metabolically resilient, more capable of resisting the toxic cascade of amyloid and tau, and better equipped to maintain synaptic function into old age. The walk and the brain are connected by pathways most people have never considered, but the biology is not speculative. The mechanisms are documented. The intervention is free, 10 minutes every day. The evidence has spoken. Your health is your responsibility, not the pharmacy's. I'll see you in the next video. Now, I want to address the sleep dimension of this story because the connection between sleep quality, glymphatic function, and dementia risk adds a practical lever that most people overlook entirely. The glymphatic system, as I described earlier, operates primarily during sleep, specifically during slow-wave sleep, the deepest stage. During slow-wave sleep, neurons actually shrink slightly, expanding the interstitial space of the brain by up to 60%. This expanded space allows cerebrospinal fluid to flush through the tissue at dramatically increased rates, clearing amyloid, tau, and other metabolic waste products accumulated during the waking day. Research from the Nethergaard Laboratory and others has shown that a single night of sleep deprivation measurably increases cerebrospinal fluid amyloid levels compared to a well-rested night. Chronic sleep restriction less than 6 hours per night sustained over years is independently associated with accelerated amyloid deposition and significantly elevated dementia risk. The connection to exercise is direct. Aerobic exercise is one of the most effective behavioral interventions for improving slow-wave sleep. Regular moderate intensity exercise reduces sleep onset latency, the time it takes to fall asleep, increases slow-wave sleep duration, and improves overall sleep architecture. A meta-analysis published in Mental Health and Physical Activity found that regular aerobic exercise significantly improved subjective and objective sleep quality across all age groups studied. So, the 10-minute walk doesn't just directly stimulate BDNF and lymphatic clearance during the walk itself. It also improves the quality of sleep that night, during which the glymphatic system does its deepest cleaning. The two mechanisms amplify each other. Walk during the day, sleep better at night, brain cleaner in the morning, repeat every day for the rest of your life. That is the protocol in its simplest biological form. Let me also be direct about what 10 minutes a day will not do, because honesty about limitations is part of what builds trust on this channel. 10 minutes of walking per day done in isolation from other lifestyle factors is unlikely to overcome the dementia risk conferred by severe untreated hypertension, chronic heavy alcohol use, uncontrolled type 2 diabetes, chronic sleep deprivation, severe social isolation, or advanced smoking-related vascular disease. Exercise is powerful. It is not omnipotent. It works within a system, and the other inputs to that system matter. Blood pressure control, as I've said, is the single most important modifiable risk factor for vascular dementia. Social engagement, maintaining meaningful interpersonal relationships, remaining cognitively active, continuing to learn new skills is independently protective against dementia, with epidemiological data showing that social isolation carries a dementia risk comparable in magnitude to physical inactivity. Hearing loss, increasingly recognized as a modifiable dementia risk factor by the Lancet Commission on Dementia Prevention, should be assessed and treated. Uncorrected hearing loss forces the brain to allocate cognitive resources to decoding degraded auditory signals, accelerating cognitive load, and potentially depleting the same prefrontal resources needed for executive function. 10 minutes of walking is the foundation. It is the most accessible, most studied, most powerful single daily behavior available to you. Build the other factors around it, but start with the walk. Start tomorrow.